have to consider that during pregnancy and also during preconception and breastfeeding, there are increased needs for specific nutrients. We have a lot of evidence for the increased needs for folate and for iron, but also DHA has an increased need during pregnancy that exceeds the need of the calories. Even if the mother has very good type of diet, she needs to increase the intake of specific essential micronutrients. And current recommendations regarding intake of omega-3 in women that are not pregnant are that a woman in her fertile age should have an intake of approximately 250 milligrams per day of EPA DHA, but this recommendation needs to be increased of 200 milligrams per day of DHA during pregnancy and lactation. But a large part of the population does not meet these recommendations because the quality of diet is not always so good. Therefore, it is important to supplement with DHA. It's also interesting to know that DHA may be supplemented not only as fish oil, but also as algal omega-3. This has some important potential positive effects because it has more DHA, it's free from marine contaminants, and it preserves marine ecosystems. And also it is well accepted by mothers that are following a vegan or vegetarian diet, but it can be used by everybody. We have to consider that DHA has many important benefits during pregnancy, and particularly it is well known that it has a role in the development of the eye and of the brain because it is deposited exponentially in the last months of pregnancy in the brain. It is also important to realize that in the last years, there have been emerging data showing a reduction of the risk of preterm birth with DHA. So therefore, healthcare practitioners and particularly obstetricians and midwives and nurses need to know this aspect, and they also need to investigate the DHA status and intake of their patients to make the right recommendation for them. So this can be investigated with questions that mainly investigate the intake of fish. So it can either be a very easy question like it is proposed in the FIGO nutrition checklist that actually is only the question of whether a woman has an intake of at least 2-3 times of fish per week, or it can be more specific and addressing with 7 questions with a questionnaire that was developed by Dr. Susan Carson, 7 questions that address specific fish intake, but this needs to be eventually modified according to the type of diet of the country where we use it. Topic that we are addressing is very important because preterm birth is a very important clinical condition that leads to the birth of babies that can be at higher risk of morbidity and mortality, and they may have handicaps or may have also an increased risk of developing later on disease in their lives. So we have to be very well aware that we need to be utilizing all potential tools to reduce the rate of preterm birth. So the evidence about DHA has been long already, that we know that a low DHA status is associated with more preterm births. Also, we have now really sufficient data that with randomized controlled trials that have randomized to incrementing the intake of DHA with supplements, the women that were supplemented had a significantly decreased rate of preterm deliveries. And this has now reached enough level of evidence, it's strong evidence, it has been recognized in the Cochrane review and more recent data also from from ORIP and the ADOR trial show strong correlation between DHA levels and the timing of delivery. So this is an important achievement. The development of this clinical practice guideline was a process where a number of scientific societies have been working together to reach a consensus, not only based on the randomized controlled trials that had already strong evidence, but also a consensus to becoming involved in implementing this knowledge. So this clinical practice guideline was developed to explain to society, but also to colleagues, how they should, in practice, develop this knowledge with their patients. And so what it says, it has women in pregnancy need to have enough DHA intake. So this means that apart from their usual intake, that should be before pregnancy around 250 milligrams per day of DHA, this should be increased of 200 milligrams per day during pregnancy. This is not always achievable with diet, but it should be investigated at the beginning of pregnancy with simple questions, or potentially also with a blood test, but this is not still in the clinical guidelines. So therefore, if the woman does not have enough intake of fish, she should be supplemented. If we are not able to investigate adequately the intake of fish, we should supplement anyhow. So this additional supply should start before the 20th week of pregnancy and should be continued throughout the 37th week of gestation when we know we reach term of pregnancy, so then it can be stopped. So this should be really made available as a knowledge to all colleagues throughout the world to decrease this very important outcome of pregnancy, that is preterm birth.